The hospital wanted to reduce the bill for the surgery, but the patient insisted on doing everything by the book, so now he must pay twice as much. Backstory: I used to work in the public relations department at a public hospital. The department where all sorts of nonsense gets dumped when nobody wants to deal with it, when it's unclear whose responsibility it is, or when they simply want to pass the buck as far away as possible. It was difficult coping with the workload under a yes-man PR director who usually agreed to virtually any request for help, especially after other employees gave standard excuses like, "This concerns the patient, so let the public relations department handle it," or flattered with, "You guys are so great at this, we just mess it up better, leave it to you." Besides the public relations department, there existed a medical case management department that handled more complex cases, legal issues, complicated medical situations, or interdisciplinary cases. Due to the nature of the work, cases were sometimes transferred back and forth between these two departments. I was partially involved in this particular case, but it was my colleague who maliciously complied with the instructions. Key players: Cynthia, Director of Medical Case Management; Joell, Medical Case Management Employee; Sarah, Finance Department Employee; Mr. Natty, retired patient with no income. Now the story itself. This happened almost 10 years ago, and not in the USA. Mr. Natty underwent surgery. Everything went successfully, and a few days later he left the hospital to recover at home. At home, he carefully studied the bill he'd been given, called the hospital about an allegedly made error, and was transferred to me. For confidentiality and simplicity, let's call the disputed item organ transplant. Mr. Natty claimed he'd had no organ transplant, only a couple of medical devices had been installed. At that point, he was still quite pleasant to communicate with. I assured him I'd call back after checking. Since this case wasn't urgent, it took the finance and surgical departments about 2 weeks to sort out the details and clarify what had happened. Meanwhile, by the end of the first week, Mr. Natty had already started sending me letters, asking when he'd receive the promised refund. Curiously, I had absolutely no memory of promising him any refund. According to internal company policy, I was obligated to respond to every one of his letters. By the time the finance people finally gave me a detailed response about his case, I already knew his email address and phone number by heart, and he himself was becoming increasingly irritable. I contacted Mr. Natty and confirmed to him that he was right. There truly had been no organ transplant. The organ transplant on the bill was actually just a conventional designation for a bundled service package that included many items used during the surgery, including the installed medical devices. The surgical department was aware of his financial situation and, to help him save money, provided a bundled service instead of billing each item separately, as that would have cost significantly more. My response flipped some sort of switch in Mr. Natty's brain, and he simply exploded. He screamed that a public hospital existing on taxpayers' money should behave more honestly and demanded that the bill be amended to fully reflect everything that had been performed and used during the surgery without any exceptions. Even when they explained to him that under such circumstances the amount would most likely be significantly higher, he did not abandon the idea of following principles. I was still relatively new back then, so I informed Mr. Natty that I needed to consult with someone to find out whether fulfilling his request was possible, and ended the call. It was at this very moment that Cynthia approached me and asked if everything was okay with me. She'd been walking past as the conversation was ending and stayed nearby after noticing I was upset and nervous. I told her what had happened, and she very kindly offered to transfer the case to her department since they were accustomed to working with such cases, and it wouldn't be much trouble for them. I agreed without a second thought, as I was already tired of Mr. Natty. A day or two later, I called him to inform him that Joell would now handle his case. After that, I heard nothing more about this situation, not from Joell, not from Cynthia, not from Mr. Natty, and completely forgot about it. Until 4 years after that incident, a large-scale reorganization happened at the hospital. Cynthia and Joell resigned. The medical case management department was closed, and the public relations department was merged with several others, now handling even more nonsense. Then, one fine day, Sarah from the finance department calls me about a patient who claims he communicated with employees regarding an error in his bill, and that his problem remained unresolved. Though Sarah wasn't sure, since the patient insisted he'd spoken to Cassandra, Gordon, and the author, and categorically refused to acknowledge Cynthia, Joell, or me when Sarah tried to clarify if it was really us. After archaeological excavations in the archives and medical records, it turned out that the caller was that same Mr. Natty, and it was about that same problem, but with an unexpected twist. As it turned out, when Joell contacted Mr. Natty, he tried to explain that fulfilling his demand for a detailed bill would entail substantial additional costs on his part. Mr. Natty simply refused to accept any explanations and began screaming moral lectures at him. Moreover, he threatened to complain to various government agencies about the hospital's allegedly illegal actions, and subsequently, apparently, did indeed complain to at least a couple of such agencies. Here I must admit that Joell was a much more professional employee than I was, and usually exemplified calmness and endurance, capable of enduring a ton of crap without wanting to kill anyone. Apparently, Mr. Natty deliberately behaved in the worst possible way, because in 4 years of working together, I'd never seen Joell act like this before. Typically, in such cases, Joell would usually transfer the case to Cynthia with a recommendation to ignore the request or respond with an official letter and close the matter. Cynthia would usually agree if it was a morally justified decision, not entailing edits or medical consequences. But this time, Joell didn't do that. He decided to fulfill Mr. Natty's demands. He told the surgical department what had happened. Angered by how their goodwill had been rudely rejected and trampled, the surgical department agreed to the changes and involved the finance department to ensure that every manipulation, every tool, and every item used during the surgery was meticulously reflected in the bill. No bundled services or attempts to save Mr. Natty money. It turned out that the organ transplant wasn't the only item on the bill that had been listed as a bundled service in attempts to reduce the final cost. As a result, the bill doubled. Mr. Natty was extremely displeased when Joell sent him the new detailed bill. He refused to pay it and spent another year periodically pestering Joell with threats and complaints until he finally disappeared. I asked Sarah why Mr. Natty had reappeared after so many years. It turned out that a debt collection agency had tracked him down. Mr. Natty had moved and hadn't updated his contact details. He also hadn't shown up for medical checkups. Unpaid bills were eventually transferred to collectors after some time, who used the contact data available in the hospital system. And so, after all these years, Mr. Natty finally showed up for a medical checkup and was forced to provide up-to-date information. The collectors quickly learned about this and resumed the debt recovery process. Somehow, I managed to dig up the remnants of my almost completely depleted compassion and asked Sarah if there was any way at all to cancel the changes that had been made. Sarah laughed and pointed out that due to the publicly available state insurance, Mr. Natty's medical expenses had initially been covered by approximately 80% largely thanks to special bundled services like the organ transplant that the surgical department had used. However, after his demands, the insurance covered only about 30% of the new bill, which had already doubled. And the most wonderful thing about all this is that such bills are sent to a government agency, and only one change can be made to them unless the hospital officially admits an error, which could lead to hefty fines. This rule exists to prevent hospitals from changing bills left and right, and to reduce administrative costs. And lo and behold, a miracle of miracles. One of the agencies Mr. Natty had complained to about our allegedly illegal actions turned out to be that very agency responsible for covering medical bills. Thus, the government body was not only aware of his not-too-bright demands, but also knew perfectly well that we had tried to help him, yet changed the bill solely at his request. And, naturally, the hospital had absolutely no intention of incurring fines for Mr. Natty's sake. With immense, genuine pleasure, I made the final call to Mr. Natty. He didn't recognize me, but I felt enormous pleasure, reminding him that it was me, yes, me who had first spoken to him 5 years ago. "Don't you remember me? The one you screamed at back then?" "No?" "Oh, no big deal. So many years have passed." "Ah, is it not about the time past, but that he simply didn't deem it necessary to remember our names because we're just customer service staff?" Well, all right. After that, I didn't continue the polite chit-chat and immediately got to the point, informing him that we couldn't change the bill again, since changes are permitted only once. Amazingly, he didn't explode right away, and even asked why. I explained. A long pause hung in the air, and just as I started worrying whether he'd lost consciousness, Mr. Natty exploded. He started yelling that this was all lies, that we were dishonest, that he was a retiree with no money. How could we do this to him? Why did we make the changes knowing the final amount would increase? And how could it even happen that the new bill became larger? Surely it was a mistake, and so on and so forth. By that time, I was already an experienced employee and usually ended such calls after 3 warnings. My dear readers, in Mr. Natty's case, I did not do that. I patiently waited until he ran out of steam, hurled his last curse, and in the ensuing silence simply said, "The bill was detailed and amended at your request, sir." Ha ha ha. Amended. P.S. I've seen several comments claiming Mr. Natty allegedly wasn't explained the preliminary cost of the surgery beforehand and other discussions on this topic. I apologize for not mentioning these details immediately. It seemed to me they weren't so important since the story was already quite long, but for clarity, I'll specify. Mr. Natty was informed of the approximate cost range even before he agreed to the surgery. If I recall correctly, his initial final bill turned out slightly higher because complications arose during the surgery, requiring more medical items installed than anticipated. Nevertheless, the amount remained within the acceptable range thanks to the hospital accommodating him by billing with bundled services. Secondly, the country has accessible financial aid options, but Mr. Natty refused all offers when we voiced them. To phrase it softly, his response was roughly, "What? Do you want me to grovel and beg someone for help?" No, Mr. Natty, we truly just wanted to help you. Honestly. Well, at least until you drove even Joell to the point of fury. Edited number 2. I didn't expect to have to write this additionally, but a surprisingly large number of people are worried about Mr. Natty's health and financial situation. You are all incredibly kind people. I hasten to reassure you, Mr. Natty's health and financial situation were never in jeopardy. Some hospitals have interconnected medical databases, but their billing systems are not linked. Mr. Natty always had access to a wide range of medical services elsewhere, and he would never have been left without medical care or financial support if he'd wanted to receive it. Moreover, he could even have repeated this scheme, gotten surgery, and disappeared at another hospital, gradually shrinking his list of available hospitals. In fact, I'm almost sure that's exactly what he did for 3 or 4 years until he showed up with us. Perhaps he hoped we'd have forgotten his debt by then. Apologies for the inappropriate chuckle. Story 2. Pharmacy staff refused to stay briefly after closing. I complained to their boss, and their workday got extended by an hour. I once worked as a clinical research coordinator in a hospital. If you work in medicine, following prescribed laws and rules is critically important. Problems begin when people start inventing their own rules and acting on them. The most difficult part of my job was convincing other departments to fulfill their duties. Sometimes it was extremely hard. I had to persuade everyone just to complete basic tasks. Ask a nurse to take a basic blood test in 4 tubes. They roll their eyes. Ask pharmacists to stay 5 minutes after the end of their workday. No, they can't do that. At precisely 4:30 p.m., they're already heading home. The second scenario is key to this story. The pharmacy department categorically refused to stay after work. I understand why they wanted to stick to a stable schedule, but in a world of sick and dying people, unforeseen situations sometimes arise. By the way, I regularly had to stay an hour or 2 after my shift ended to deal with problems or enter data. In my department, this was normal. Overtime was calmly paid, or we were given flexible schedules. Our hospital was in a large city with very snowy winters. Several years ago, heavy snowfall was expected. Every one of us, nurses, doctors, pharmacists, coordinators, were essential personnel and obligated to report to work regardless of the weather. So all of us had to come in the next day no matter the weather. If we didn't show up due to weather, we'd have to take sick leave. The day before the promised snowfall, we had a patient at the clinic. Usually, patients in this particular study first had a doctor's appointment and immediately after received treatment. However, this person had a job and preferred to have the examination in the afternoon and receive the actual treatment early the next morning. This was unusual, but we easily accommodated. Though most of us resigned ourselves to the necessity of driving to work the next day in the snowstorm, the investigational drug pharmacy, IDP department, was especially unhappy with the prospect. So at 3:30 p.m. 1 hour before pharmacy closing, they sent me a Slack message asking if there was any possibility to conduct the patient's treatment today so they wouldn't have to come tomorrow. Seriously? You're asking? Now? Nevertheless, I reluctantly went to the waiting room and asked the patient. He wasn't thrilled, but said he was ready to undergo the treatment now if necessary. I informed the pharmacist. Then they asked me about the patient's status. The clinic, as usual, was running late, and the patient hadn't yet been cleared for the procedure. The investigational pharmacy required at least 20 minutes to prepare the necessary medications, so they gave us a deadline of 4 p.m. to get the doctor-signed order. The process of obtaining the drugs was as follows. Get the order signed by the doctor after the patient is officially cleared for the medication. Take the prescription. Cross the street. Enter the pharmacy. Hand the signed prescription to the pharmacist. Wait for the medication to be dispensed. Return with it to the patient in the first building. It was utterly obvious that accomplishing this in roughly 12 minutes was simply impossible. At 4:01 p.m., a pharmacy employee sent me a very rude message in Slack, essentially stating that I had missed the chance to treat the patient today and that next time I should try harder. Coordinators get blamed for everything, even if the cause is the doctor's poor time management. The message sounded roughly like this: if you do not hand the prescription to the pharmacist by 4:05 p.m., we cannot help your patient. In the future, you should obtain the signed prescription in advance and hand it to us for medication preparation. By in advance, they meant a situation where the patient was prescribed the drug even before the doctor officially confirmed the patient was ready to receive it. During my training, the pharmacy director had strictly warned us never to do this. It was categorically forbidden and could lead to a huge lawsuit if something went wrong. You cannot prepare medications until the patient is officially cleared by the doctor. I really liked the pharmacy director, and I regularly consulted with her about drugs patients could take during studies. However, she didn't delve deeply into the pharmacy staff's day-to-day work, focusing more on general strategic tasks. That's why her employees started inventing their own rules and demands. So you need this patient treated today? Right now? Well, all right, since you insist. So I obtained the doctor-signed order before the doctor had even seen the patient. The doctors largely didn't care. The next step, according to the person who sent me the message, was to hand the prescription to the pharmacist. You said I must hand the prescription to the pharmacist by 4:05 p.m., right? What if, instead of going straight to the pharmacy, I go straight to the pharmacy director? She's also a pharmacist and could do everything the investigational pharmacy staff could. I told the pharmacy director, the patient hasn't been officially cleared for treatment yet, but the pharmacists insist I get the medication prepared early so the patient won't have to come tomorrow in the snowstorm. She looked surprised and asked if the patient had rescheduled the appointment during the clinic visit. I answered, no, this was a request from the pharmacy staff who didn't want to commute in bad weather. I showed her the message sent by her staff. The pharmacy director was visibly displeased and declared that someone would have to stay late if this was the plan. I showed her the Slack message where it stated I had already missed my chance because the staff weren't planning to stay after work. The director flew into a rage and stated she would personally stay at work longer to oversee this matter. We headed to the pharmacy together from her office. She wanted to reprimand that employee, but of course, nobody was there anymore. In the end, the two of us retrieved the medication at 4:35 p.m., and I gave it to the patient. A week later, the patient called saying he liked receiving treatment on Thursday afternoons rather than Friday mornings and wanted to stick to that schedule going forward. I relayed this wish to the pharmacy director, expressing doubts about how we could organize this permanently. She said she'd figure it out and contact me. A few days later, an email arrived informing us all that the investigational drug pharmacy would now operate until 5:30 p.m. daily, and one employee would stay late on rotation to handle evening medication orders. But I knew the department had only 3 pharmacists, all salaried, not hourly. This meant one of them would have to stay late more than once a week. Several weeks later, around 4:45 p.m., I went to pick up the medication for this patient. That same rule-breaking employee was working. I asked how she was doing. She replied with obvious irritation that she now had to work 3 times a week until 5:30 p.m., probably punishment for her unethical behavior weeks earlier. She thrust the bag of pills at me and slammed the window shut right in my face. And yet, if the pharmacists had simply calmly done their job properly and come in once during the snowfall, they'd still be leaving home peacefully at exactly 4:30 p.m. If you work in medicine or medical research, don't invent your own rules. Well, that's all the stories for today. Thanks for watching this video to the end or listening to these stories in the background while cleaning, cooking, studying, or whatever else as you write in the comments. Also, watch our previous videos, which you'll see right here. Subscribe to our channel, and good luck to you.